Hey guys, it's me again. Yes, I have on the same thing. Yes, in the other video. Yes, okay, don't judge me, okay? Alright then. Now, so as you can tell by the title, this is about my VSG surgery. First of all, why did I decide to get VSG surgery? And for those of you who do not know, VSG is for vertical sleeve gastrectomy. So the reason that I decided to get it was because I was having health issues. Like 3 people that I know had the surgery and they were doing well with it and everything. My doctor had suggested it to me before, and I didn't want to have any type of surgery or anything, you know. I don't want nobody cutting on me and I could do it on my own and all this stuff. And I just ignored it. And my health problems got worse. I was diagnosed with type 2 diabetes, high blood pressure, high cholesterol. Even though I was trying to lose weight, I cut back on eating like junk food, and I was eating like you know, grilled chicken, veggies, you know, doing what I'm supposed to do, up in my water, you know, walking, stuff like that. I was losing, but not really losing. I was losing like a couple pounds here and there, but nothing significant enough where it was making my health better. So I started doing my research on it, and I found out a lot of information, you know, a lot of information. And I saw that it wasn't as bad as I thought in my head it was going to be, as far as the surgery and stuff like that. And I learned the benefits of the surgery, and you know, just did my research. And I did my research for a long time before I decided to get the surgery, because I wanted to make sure this was something that I wanted to do, because this is something that can't be reversed, you know. So I decided, you know, to do my research. And like I said, I did my research probably for like almost a year, reading, talking to people that had the surgery, watching videos on YouTube, talking to my doctor about it and stuff like that. So I decided to go ahead and do it. I said, why not? So the first step I did was I went online and I googled the best bariatric surgeons in Maryland. That's what I googled, and my surgeon name happened to be the first one that popped up. And I googled him, and come to find out he was one of the top surgeons in Maryland, like I said. And I saw that he was having a seminar, so I decided to attend the seminar to, you know, get more information about it and see what he was all about, you know, and stuff like that. So I went to the seminar, I got a lot of information. The seminar probably was like, maybe like 2 hours to 2.5 hours long, but it was well worth it. It was a lot of people there. Like I said, I found out more information, you know, what he was about and everything. And I really felt comfortable with him, and I really, you know, liked the way that he was at the seminar and everything. He made everybody feel comfortable and everything, and I liked that. And I decided to go with him. So they give you like this little packet with like all the information and stuff, you know, the steps that you need to take to lead up to having the surgery. So the first step was to contact your insurance company to find out if your insurance company covers the surgery. Now there's a couple of different surgeries. There's VSG, there's the gastric bypass. It's another one, I'm not sure how to pronounce it. I think it's called dual switch or something like that. I'm not sure. But I know I didn't want the gastric bypass, because that involves rerouting your intestines and all that stuff, and no, I didn't want that. So for me, the vertical sleeve was the best option for me personally. What I like might not be what somebody else likes, so I suggest that you do your research and find which one is best for you. Don't just go by what I said, because I said that's my best option, but you know, like I said, what I like might not be what you like. So make sure you do your research and find the one that's best for you if you're interested in getting the surgery. Also, again, like I said on another video, I didn't get the surgery for cosmetic reasons. I got the surgery for health reasons, to be more healthier, because I had health issues. Again, high blood pressure, type 2 diabetes, and high cholesterol. So I knew that having a surgery would, you know, help me lose the weight, and those 3 health issues would improve. And I have to say, since the surgery, I'm no longer type 2 diabetic. So that's definitely a plus, and you know, definitely a plus. Thank you, Jesus. And I'm only, Wednesday will make 8 weeks, so that's 2 months post-op. So, and I'm down 32 pounds, so that's definitely a blessing. But again, the first thing you need to do is contact your insurance company to make sure that they cover the surgery, or how much of the surgery, percentage of the surgery that they, you know, cover and everything. And I contacted my insurance company, and thank God my insurance covered the surgery 100%, even though I did have a deductible, but it wasn't really a lot, but they covered the insurance. What else? And and I also found out from the insurance company, and with the packet that I got from the surgeon at the seminar, that, you know, the other requirements, the other things that needed to be done, the other requirements that the insurance company required in order to cover the surgery. So that was attend the seminar, which I did. I had to do 4 months of supervised weight loss with my primary doctor, or I could have went to like Weight Watchers or Jenny Craig or something like that, but they just wanted it to be documented that I, you know, tried some type of weight loss program, and you know, and my weight was tracked or whatever. So I decided to go with my primary care doctor tracking my my weight for 4 months. I know some insurance companies do it for 4 months. I have Cigna Health Spring, so Cigna, you do it for 4 months. I know other insurance companies, you have to do it for 6 months. So you have to definitely find out, like I said, do your research and find out from your insurance company what they require. So I did the 4 months. What else I have to do? Oh, I had to take nutrition classes. I think I did like 3 nutrition classes. I think it was 3. So I had to do the 4 months of weigh-ins with my doctor. He gave me a diet to a low carb diet to follow, and you know, I went to see him once a month for those 4 months, and each time I went, you know, he weighed me and documented my my weight. I had to take this form to him to fill out, and he had to document it on paper. Okay. And I did the nutrition classes, and they also sent, you know, when I complete the classes, they sent that to my surgeon's office. And I guess they sent a copy to the insurance company also. Then I had to have a psychiatric evaluation. Of course, I passed that. And they sent a copy of that to my insurance company, and I guess the surgeon's office also. But they want to make sure that you're mentally prepared for the surgery, because some people aren't, you know, and I have to say, it is definitely mental. It's definitely a mental thing, because you go through so many emotions. I know I went through so many emotions going through the process. I was scared, excited, just, I mean, you go through a lot mentally. You have to make sure you're mentally prepared for this, like I said. What else? I did a psych evaluation. I had to do blood work. I had to do like a cardiac clearance, which only was like an EKG to make sure that my heart was okay and stuff like that. I had to take this other test. I can't pronounce it, but I know that you breathe, you drink this stuff, and then you breathe into this bag, so they can just test to see if you have any type of bacteria in your stomach. I think, yeah, in your stomach area. Past that, let me see what else. Okay, and I did that. Okay, and then after I got all my paperwork in order, I took it to my surgeon's office, and they submitted it for me to my insurance company. I say within a week. Yeah, I say about a week. I found, well, within a week, they usually send you a letter or the surgeon's office call you. I didn't get either. So I said, you know what? I'm going to call the insurance company myself to see what's going on. So I called the insurance company, and they said, yes, Miss White, you have been approved for your surgery and everything. So you should contact your surgeon's office. So that's what I did. I was so excited. And as soon as I got off the phone with them, I called the surgeon's office, and, they was like, yeah, you was approved and everything. We were going to give you a call. And they said that we're going to call you back. The surgical coordinator is going to call you back to confirm your surgery date after we look at the schedule for the surgeon. And we're going to confirm your surgery date. So probably like 2 days later, they called me back and confirmed my surgery date. And my surgery date was July the 25th of this year, so 2018. So, let me see. I'm going to be honest. Before I started the liquid diet, I wanted to have a little food funeral. As some people call it, a food funeral, to eat foods that I like, that I'm like, oh my goodness, I'm never going to be able to eat this or eat that or whatever. Because having a vertical sleeve gastrectomy, they remove 80% of your stomach. So your stomach will be like the shape of a banana. So you will only be able to hold no more than maybe 4 ounces of food or less. And, yeah, so I wanted to eat, what I wanted to eat and stuff like that. So I only did it for a little bit, and then I had to start the week liquid diet to shrink my liver for the surgery. And I did pretty good, which I thought in my head, I was like, man, there's no way I'm going to be able to do this liquid diet, But I was allowed to eat 2 lean meals because... or a lean meal because of the simple fact that, like I said, I was a type 2 diabetic, and my medication that I took, I had to eat with it. So they allowed me to eat like grilled chicken and veggies, stuff like that, or like fish and veggies or whatever, my choice. So I did that, for a week. It wasn't too bad. I lost weight with that. I probably lost about maybe 6 or 7 pounds, and that's only to shrink your liver. You do the liquid diet. Some people have to do the liquid diet for 2 weeks. Thank God I only had a week. So yeah, what else? I did the liquid diet. It wasn't really hard because, like I said, I was eating a grilled chicken and the veggies. Now if I had to do strictly liquid, like that probably would have just I don't know how I would have been able to handle it, but it was okay. Let me see what else. Did the liquid diet. I had to stop taking my medications. Well, I had to stop taking my type 2 diabetes medicine a couple of days before the surgery. And my blood pressure medicine, I had to take that the morning of my surgery. And I did that. And I was nervous. And I kept telling myself, I'm not scared, But I mean... I wasn't even nervous at the fact of being put to sleep. I think I was more nervous of how much pain I was going to be in afterwards. I think I was nervous about that. But then it just popped in my head like, why are you nervous about the pain afterwards? They're going to give you pain medicine. So, I mean, I've had abdominal surgery before, so I knew what to expect. So everything just went so quick. Like, I had to be there, I think... My surgery was going to be at 7:30 in the morning. It was scheduled for 7:30, and I think I had to be at the hospital at like 5:30 or something like that. I believe so. And I was a little nervous, I ain't gonna lie, but my surgeon was a little late, but it was okay. I had my family there. I had hubby there, my sister, my dad's wife. My dad had to work. let me see. They called me back. I was obviously the first person to go into the OR that day, that morning. So they called me back and everything, and they prepped me, and you know, they started the IV and everything. Then they let my family come back with me until they took me back to the OR. Now, let me tell y'all this. This is the only thing that I remember. This is the only thing I remember up until that point. I remember saying, you know, before they wheeled me into the OR, I remember saying goodbye to my family, giving them a kiss, you know, and stuff like that. I remember them wheeling me into the OR. I remember looking over and seeing my surgeon come out of the other room. You know, I guess he had scrubbed up or whatever they do. And it was like maybe like 30 people in the room, maybe like different, I guess, people that were going to assist the surgeon and nurses and anesthesiologists. It was like at least 30 or more people in the room. The only thing I remember is, like I said, looking at my surgeon into the room, and he smiled at me and I'm smiling at him. And that was it. The next thing I remember is them waking me up. Miss White, wake up. Your surgery went great. Wake up, Miss White. That's all I kept hearing. And I remember myself saying, oh my goodness, my stomach hurt. I just remember that. And then the next thing I remember, it's like bits and pieces, because like I said, they had, you know, me on the pain medicine. But I was also on a self-administered pain pump where I could just push the button myself. And I had that before, like I said, when I had abdominal surgery before, and I didn't like, you know, like that. But I would say it's worth it, and I would do it all over again. Let me see. Yes, it is painful, but it's not as bad as I thought it was going to be. I just thought it was going to be just so horrible, you know. But it really wasn't that bad. It was just the gas that made me feel uncomfortable and gave me discomfort. But walking definitely does help. If you get the surgery, please make sure that you walk. Walk, get up and walk, because it helps that gas, to move that gas out. Yeah, so they do get you up like a few hours after the surgery to get you up, to get you start walking, and, you know, get up, going to the bathroom on your own and stuff like that. And my sister did stay with me the 2 days that I was in the hospital. She stayed the night with me, and hubby, you know, of course, came and was there with me also. And my sister said I was saying some crazy stuff. I don't even remember. It was the medicine. So you know, it was only painful getting out of bed. Like, I was fine once I got up on my feet, but from the laying position to getting up, it's like, you know, it was really, really, you know, painful, you know. But after that, and I got up and started walking around or walking to the bathroom, it wasn't, you know, that bad and everything. I would say probably like, it took like a week and a half for me to feel like myself. I was still sore, but it took me like a week and a half to feel like myself again. And like I said, they cut 80% of your stomach, so you're only able to hold so much. So they give you like these little, you know how like the medicine cups that you have in, like when you get cough syrup or something like that, and it's like the little 2-ounce cups, plastic cups that comes with it. You can only like sip on that. Like, they want you to make sure you get your fluids in, but right after the surgery, you just sipping on that, because that's like mainly you can drink at one time. And I bought these from the Dollar Tree, but it's like the cup's about this size. This is about 2 ounces, and it's about this size. It's a little miniature cups and everything. But I got home. They wanted me to start my vitamins right away, because yes, I'm gonna have to take vitamins for the rest of my life. So it's not that bad. I feel great. I haven't had nausea. I haven't threw up. The only thing, and this might be TMI, the only thing I had issue with is constipation. And that's because I take the calcium, whatever it's called, the calcium, and it causes that. But anyway, but if I had the chance to do it all over again, would I do it? Yes. My health issue, like I said, I'm no longer type 2 diabetes. Have type 2 diabetes. That's resolved. My blood sugars are normal. I'm still, my blood pressure is controlled with medicine, but hopefully as the weight keep coming off, I could be tapered off of it or completely stop, you know, taking the blood pressure medicine and my blood pressure be regulated. As I said before, my starting weight was, well, my highest weight was 250 pounds. I'm 5'2". My highest weight was 250 pounds. My surgery weight was 246 pounds. And now I am 212 pounds as of today. So that's a total loss of 33 pounds. So I'm proud of myself. I've been doing everything, following everything that I'm supposed to be following. I went to my 6 weeks post-op appointment and saw my surgeon. And he said I'm doing amazing. He's proud of me. I'm ahead of the game and keep doing what I'm doing. So, you know, that made me feel really good because I thought, you know, being a slow loser. But they say you would want to lose slow because you don't want to have like the sagging skin and stuff like that. And it's like really crazy. It's like, you know, from doing my research and being in the groups and stuff like that on Facebook and stuff like that, and knowing people that had the surgery too, it's crazy. They say that you can look at yourself in the mirror and you don't really see the change or the difference in yourself until you compare before and after pictures. And I feel that, like, when I look in the mirror, I still see, you know, I can't see it. I can't see like the 33 pounds that I've lost. I can't see it. I can tell the difference in my clothes, like the inches and stuff like that. At times I can see it, but other times I just see myself as being the old me until I do like side by side before and after pictures, and I really can tell the difference. But it's just weird. Like, maybe because I saw myself overweight, you know, for so long, I just still see myself like that. But it's definitely a mental thing. But I'm happy with my progress. You know, I'm happy. You know, I'm still learning. So like I said, it's a journey. Everybody's journey is different. So I'm learning. And I'm doing great. Like I said, I haven't had any issues, any problems, you know. I need to definitely incorporate an exercise program. Other than walking, I need to do something. Because I want to, as I'm losing, I want to start toning. So I'm definitely going to get me a gym membership, maybe to Planet Fitness or something like that, maybe. So, but like I said, I hope this video helped someone out there who was deciding on maybe or thinking about getting VSG, you know, surgery. So this is my experience. Just because, you know, I went through what I went through in my experience doesn't mean that someone is going to go through the same exact thing. Everybody's journey is different. Remember that. Everybody's pain tolerance is different. So but it's definitely worth it, and the pain is not temporary. Like, I did, you know, have doubts in my mind in the beginning. Like I said, like, I was scared. You know, I don't want to be cut on and this, that, and the other. Oh, and again, it wasn't an open surgery. It was done laparoscopically, where they do like 5 small incisions and do it like robotically. And I also had a hernia repair too. So, so yeah. But pain is only temporary. So the benefits outweigh the pain, basically. So, so I look forward to this journey, and I look forward to you guys like coming along on my journey with me and everything. If you're watching this and you've had VSG surgery or you have had weight loss surgery, please feel free to comment. Feel free to subscribe. If you have any questions, I'll be more than happy to answer. Subscribe to my page. I keep saying my page. Subscribe to my channel. I do subscribe back. I do comment back. You know, I do get, you know. No negativity though, please. This is a no negativity, no judgment channel, please. Please. No drama. We don't do drama over here with negativity. So anyway, but it's been good talking to you guys. It feels so good. And I told you guys I was going to be kicking out these videos, and I am. So, again, if you're watching this and you've been watching this video this far, please pause this video and hit that subscribe button. Comment, thumbs up this video. Become a part of the family. As you guys know, I do call you guys my family. Become a part of the family. So I look forward to talk to you guys in the next video. So you guys take care.